Okay, we're going to talk about that mysterious illness now that is being linked to COVID-19, impacting some children. So we've seen the first case in North Texas, and health and wellness reporter Sonia Azad here in the studio. So should this be a growing concern for families?
Well, I think it's still in the rare category, but it's something that a lot of people are obviously paying attention to. And you have to remember, as we mentioned yesterday, you guys, this COVID-19 is something we only have about 150 days worth of research on as it relates to this country. It's been an evolving mystery for months, and now doctors are working to learn more about this new illness called multisystem inflammatory syndrome. You might see it as MIS-C when you're reading about it. Cook Children says they've identified 4 cases in children ranging from 6 to 14 years old. They were all exposed to someone with COVID-19, but only 1 child tested positive for the virus. Now, this illness often looks similar to something else we've talked about called Kawasaki disease, which can start with a fever and flat rashes on the skin, along with aches and pains. An infectious disease doctor at Cook Children says the biggest concern is inflammation of organ or organ failure.
The biggest concern we have right now, especially with kids, is largely stemming from inflammation around the heart. The level of inflammation we're talking about, the damage it can do is certainly can be fatal, and we need to take it very seriously.
Doctors say this is a very new thing. They're still trying to understand the course it'll take. Children's Health, meantime, in Dallas says they're investigating cases but haven't confirmed any. Medical professionals in 20 states and Washington, D.C. are investigating more than 200 confirmed or suspected cases when it comes to sick children showing symptoms. Doctors say, parents, you got to have a conversation with your child's health care provider about their potential exposure to COVID-19. Mark.
Yeah, thank you, Sonia. Certainly that is top of mind for many parents as we enter new phases of reopening. We know that high school athletes and band members can start conditioning, strength and conditioning and drills in the second week of June. That's kind of a target date, really, because once plans are finalized, officials say schools will need preparation time to get kids back safely, and we are expecting more details about this plan later this week. Something else that is reopening that families can enjoy, Dallas and Fort Worth, the zoos there beginning on May 29th, but things will look a little bit different. You'll have to make a reservation online and purchase tickets in advance. You can't just walk up to the ticket counter and order a ticket like you're used to. Another place we are expecting to see changes, daycare facilities, where they are talking about how much cleaner they will be. Also, different sizes of classes, trying to limit the spread of COVID-19. But the bigger question is, does that change how comfortable parents feel dropping their kids off? That's our poll question this morning. WFAA.com/vote now is where you can weigh in. While you do it, I want to say good morning to Hannah Davis, who is talking about some of those changes parents can expect to see at their child care facilities.
Good morning, Mark. And I think as families weigh these options and the decisions that they're going to make, we're going to try and give them all the information about what's going on. So a lot of folks felt relief that childcare was opening back up for the public. But the question is, what's that going to look like? So yesterday, we sent our crews to talk to childcare providers about what those changes will be. We spoke to Ricky LaFawn. He's the owner of Sunrise Learning Center in McKinney. He's also the president of the Texas Licensed Childcare Association, which helps with training and licensing for over 8,000 childcare centers across the state. So he says these businesses are already starting to reopen, but this is going to be a process. The state handed down recommendations on regulations for reopening. In addition to increased sanitization, one of the biggest changes was the student to teacher ratio, especially for kids ages 6 and up. The ratio used to be 26 children to 1 teacher. Now it's down to 10 children to 1 teacher. LaVon says this change and others is going to put a financial burden on childcare centers as they try to reopen and bring their staff back.
I just think in the long run, it's going to hurt financially, not just us, but the parents and stuff, because if the numbers stay where they are, we'll have to increase tuition.
So other changes include temperature screening and more hand washing. LaFawn hopes parents remain patient and advises parents to send your kids back when it feels right for you. You know, one thing that I've been doing this morning is looking for support for childcare providers and for families. I've shared this on Twitter and Facebook. There's a couple grants that I found here locally in North Texas that's helping businesses. And there's also a lot of online resources for parents as they try to navigate how to take care of their children at home and how to make the switch or when to do that. So we put that online for folks. Kara, over to you.